So as far as a history, you know, I don't know how many of you have children or work with children who have one of these diagnoses, but you know that you're seeing a lot more of these either in your classroom or wherever you may be interacting with children. And there's not a lot of options for these children in the area except traditional therapies and medication. And I have an 8-year-old who's on the spectrum, and that's kind of what started me looking at, okay, what else can I find for my own child? And then, well, if I'm going to spend all this time trying to figure out what to do for my own child, why not, you know, take that information and make it available to everyone else in this community? Like I said, the limited resources, you know, kind of spurred me to really take a good look at what was missing in this community and what we could make available. We picked this name because it reflects our goals of using biomedical intervention, hemispheric integration to kind of retrain the brain. The brain's very plastic. You know, we used to think you would hit a certain age and that was it, it's done. We know that that's not true anymore. Throughout your lifetime, you can make changes to your brain function with the appropriate interventions. And one thing I want to stress is when we're talking about the spectrum during this conversation, we're really talking about a neurodevelopmental spectrum. Autism spectrum is a spectrum within that larger grouping, and it could be anywhere from the child with severe autism who is nonverbal, all the way up to a very high-functioning child with autism, dyslexia, and then there's a whole bunch of children who fit in between there. They don't meet any criteria for these different diagnoses that have their codes, but they have bits and pieces of these different problems that are affecting their functioning status. So when I'm saying spectrum, I'm usually referring to the neurodevelopmental spectrum, unless I specifically say autism spectrum. Dr. Rukeyser, my partner over there, is a chiropractor who's been in Port St. Lucie for about 7 years. And before coming to Florida, he was directing 2 clinics in Mississippi in a rurally underserved area. And he graduated magna cum laude from the University Chiropractic College in 1998. And has 2 children and is currently in the process of becoming certified as a chiropractic neurologist. And I'm a family practice physician, and I've been in this area for about 7 years also. Have a solo practice, seeing newborns to geriatrics, and was seeing more patients in my own practice who had these diagnoses, or I could see that they had something going on just when they were coming in for their well check. You know, back when I was in residency, I don't know if I even saw a child with autism. And, you know, a few children with ADD, and now, you know, it's rampant. And like I said, I have an 8-year-old son who's on the autism spectrum. I have an undergraduate degree in nutrition, went to Florida State, and then went to University of Miami and the University of Florida for medical school and residency. And I have 3 children. My middle child is the one on the spectrum, and I have an older daughter and a younger son. So what we do is we kind of have everything in one spot. We have on-site, we'll evaluate, we'll diagnose. A lot of the children come in, they've already been given a diagnosis. If they haven't, we will evaluate them and diagnose them. We have detailed history and physical that's done by myself. The parents or caretaker fill out some very detailed forms. We review anything that's already been done for this child, whether it be labs or any kind of behavioral screening tools. Look at what kind of therapies they're currently doing, how well are they progressing with those therapies. Then we decide, do we need to order any additional lab tests, or are there any other diagnostics that we need to do for these children. We'll do the screening tools if we need to, some of the behavioral screening tools to make that diagnosis, and then a very, very comprehensive neurologic exam, and Dr. Marty will talk about that in a little more, that we do as part of the evaluation. That plays a really important role in deciding what kind of therapies are going to be beneficial for this child. And then what we do is we take all that initial information and create a customized plan for each child. So there's not, you know, one size fits all. Every child has their own plan that they're working on. So they have a customized nutritional biomedical plan, they have a unique therapy schedule for them, and then we figure out, okay, which of our supplemental programs might be helpful for them. Maybe none of them do we think will be helpful, or maybe 1 or 2 of them, and then we sit down with the parent and say, okay, this is what we think is going to be most helpful for your child. And then we also utilize behavioral interventions also, and we'll talk a little bit about that in a second. so, once I've seen the patient, once Dr. Marty's seen the patient, we've developed a plan, they're moving along, they're doing the therapies, we have follow-up visits, I'm working with them, how's our nutrition plan working, how are the supplements working, is the child taking them, what kind of response are we seeing, oh, that doesn't seem to be working so well, we're going to move on to something else. We reassess them neurologically to make sure that the initial findings on the neurologic exam are improving and that those improvements are corresponding with improvements in behavior. It's great that an exam is improving, but we also want the child to be functioning better. That's really what the parents want. They're not so worried about all the abnormalities that when in neurologic exam, they want to make sure that their child is learning better, socializing better, the behaviors are getting better.